We're very excited to have the laser to offer the technique of laser-assisted new attachment procedure. We've waited for several years before we adopted the technique. Truthfully, we had to determine whether it actually worked. We had to see the results from other practitioners around the country. We had to read scientific articles about the technique to make sure that it worked for our patients. We know that lasers are very advantageous. We know that lasers are cutting edge. But just because it's a laser doesn't mean you have to have it in your office. We only want to use the best technique that gives us the best results. So finally, I convinced myself after a lot of research and a lot of talking to colleagues who I respect and reading a lot of journal articles, I decided that we were ready to have the laser in our office to provide the LANAP technique. And we're extremely excited because our patients benefit so much from it. Over the past 25 years, when patients have required surgical technique in order to cure their disease, we've used some conventional techniques which involved incisions and stitches. But in today's world, there have been a lot of advancements. And one of the advancements that we're most excited about is the use of a laser in our practice. And it's a very specific laser. There are lots of lasers around. There are lots of different lasers in various dentist offices. But this particular laser is useful for treating periodontal disease, and it's backed up by the FDA. It was the first laser approved to treat periodontal disease by the FDA, and also it has university studies to back it up so that we know that it works. Beyond that, a laser has tremendous benefits for patients, not the least of which is the aftermath. Patients can go about their business immediately after treatment. They can go to work the next day. They don't miss any time with their families. There's very little, if any, pain involved with laser treatment. There's little, if any, bleeding. There's little, if any, swelling. It's a complete win-win situation for the patient. Mostly they get healthy, and that's, of course, our primary goal. But in order to get healthy, if we can assure a patient that they're going to have very minimal side effects, that's absolutely something that's very favorable to a patient and very favorable for us. I will say that over the years, our patients typically do extremely well no matter what treatment we do for them. But of course, there is the occasional patient or the exceptional patient where they have some problems thereafter. With the laser, we don't have those problems any longer. The patients can get healthy. The patients can get the treatment that they need. They can get the benefit of cutting-edge technology, and it's a complete win-win for the patient, and it's a win-win for us because we feel like we've supplied them with the best possible treatment available.